mentioned I'm 70, and let's say because of your company 5 years from now, what's going to change in my world or somebody like me? What's going to be the one thing because of what you're doing that wouldn't have been true back in 2024 if we're talking about 2029?
I think in 5 years, because of Manifold, you'll have new therapies, new diagnostics, and new preventive approaches. Manifold provides a software platform for clinical research, really bringing together all of the data that we know is inside institutions, publicly available, but is really not being put together to build a complete picture of patients and really enable all kinds of researchers to make progress a lot faster. So we think of our enabling capability as making clinical research 10 times faster at 1/10 of the cost. And we believe that will help bring all of these amazing capabilities out to our future selves.
So my three-part question is, what are you doing within your very innovative spaces to put trust in, and trust being as important as technology? Who's going to pay for what you're doing, and where do those benefits accrue? And how can you make sure that the new technologies aren't just helping Steve Klasko in Miami, but helping Mrs. Jones in North Philadelphia that might not have access to an Oura Ring and Apple Watch and the technologies that you're doing?
With Manifold, I think there's a couple of ways we think about equity. One is actually supporting the researchers that are doing the equity, that are doing work with a lot of different populations, especially where there's a lot of health disparity. So all of the fantastic technologies, we've heard about here today, for example, and especially Paolo with your examples, they all need to be tested. You need to bring together clinical data, genomic data, biomarkers, geospatial, environmental, wearable data. And these are the things that are hard to do, are expensive to do. And so supporting researchers and being able to do this with health disparities, related to health disparities, has been an important part of our work. We just announced our partnership with Dr. Melissa Davis at Morehouse School of Medicine, where she's sort of really pioneering these types of data being brought together, and in fact finding the biological basis of some of the differences in disease, in addition to some of the structural and systemic aspects as well. So we're really fortunate to be able to partner with folks like that. I think the second part of equity is really the researchers themselves. The kind of expense that's historically been required to do this kind of leading edge research that brings together multimodal data, it's really not available to institutions that are not super well resourced. If you're an early investigator in your career, you just cannot do this kind of work. And what our platform is doing is really making it possible for a lot more people to do that. So, in many ways, like who is doing the research matters just as much as who is being researched. And I think we can really make a dent in that. Maybe just I'll mention briefly on trust. We think a lot about why researchers should trust the data, and actually thinking about how to make that findable, accessible, analyzable for them. So really building trust for the researchers and the data so that then they can trust the output. And then finally, who pays has been an interesting conversation for us, because one of that we traditionally sell to health systems, cancer centers, organizations like that. And one of their first concerns is, are you taking our data and selling it to pharma? And we made a very conscious choice that our fiduciary is the health system and the researcher. And so we have made that choice, but again, we make the platform pretty accessible for all kinds of researchers.
It's hit me coming over from the traditional healthcare ecosystem to General Catalyst that the humans that are involved in your team are incredibly important. And all of you have curated, because it's all your money, who you have on your team. So in 3 to 5 words, if you could just say, what defines the culture of your team that really makes it unique, that will get somebody to want to invest in you?
Impact, collaboration, innovation, and get stuff done.